right, I'm gonna hit the record button here, and we'll start in.
Okay.
Okay, so our guest this evening is Bobby Robertson. Bobby is, I would describe him as a serial entrepreneur. Uh, Bobby has started companies, scaled companies, been the CEO of several healthcare related companies, healthcare technology, home care, hospice, and has been a good friend of mine for well over 10 years. So thank you, Bobby, for joining us tonight on this series. So we're talking about American cultural shifts. And you have been in business for what, more than 30 years, I guess, right?
Yeah, just right at it. So I've been running businesses, like you said, as a serial entrepreneur for a long time.
So, Bobby, over that period of time, what what changes, what cultural changes are you seeing that affects the way you think or manage your businesses?
That's a lot of years and a lot of changes. But Alan, I think the thing that is most notable is how fast the changes are occurring over just the last few years compared to over the last 30 years. And it's been a challenge to keep up with. All of the things that we held as truths in growing businesses that provide great value are changing, and you have to constantly monitor it. It seems as though, just yesterday we were talking about, Gen X and then millennials, and now we've got this new creature of the Gen Z generation, and it is so different. And it has forced us to have to rethink everything that we thought we knew.
So when you're managing your business, when you're managing your employees, uh, tell me some of the differences that you see between, say, a Gen X, a millennial, and now this new group of Gen Z workers. What changes do you see there? How are they different from one another?
Well, there's a lot of different aspects to running a business, but one of our biggest challenges right now is recruiting, compensation, and retention. And that, if I look at just those areas of business, um, it's changed drastically. So when I think about, if I step back to when I was uh, building a career, or when I first got out of college, I worked for a couple of companies before I started doing my own companies. But I remember wanting to be the first person in the office, the last to leave, and doing everything that I could to create opportunity and to show how I could provide value for my company. And that held true for a lot of years in the companies that I ran as well, with people coming into the company. And there's been this shift in focus on value creation, I think. And, it probably most noticeably between, um, you know, somewhere in the Gen X to millennial and then now to Gen Z. The focus used to be, I want to work hard. I want to show the value that I can create for the company that I work for, and then good things will happen to me. And there's this mindset now, and I'm not saying it's bad, but it's something that we have to manage as business owners, to where it's flipped. We have to show the value that we can create for the person that we're trying to recruit and retain. Um, you
So
know,
it's kind
I
of flipping the script around a little bit instead of, as you mentioned, how do I show value to the company? Now it's a little bit more how, as an owner, or how as a company, can we show value to the coworker to try to get them to engage and stay?
Yeah, I think it is. And when you think about like Gen Z, for example, and that generation, um, they're so engaged with social media, and they've got access to so much information that generations before didn't have. And, there's this narrative about, what you can get, and, with with millennials, maybe it was what you deserve. With Gen Z, it's more, to me, what I'm seeing is what can you get, and so they're they're forgoing traditional models of advancement through careers. And there's been job hopping going on for a while, but you really have to show, as a company owner, as a business owner, you really have to show the value you can provide to the employee in a much more concise way, or you never get them to the table or even talk to
So, Bobby, what do you think has changed over time? In other words, maybe, our fathers came of age in a time where you said, well, I'm going to go to work for a certain company. I'm going to have benefits. I'm going to stay. I'm going to maybe climb the ladder. I'm going to retire from there. I mean, I believe I read one time that the average career span at a single company for a baby boomer was something like 25 years. Today,
them.
I believe it's less than two. What do you think changed between, say, that baby boomer generation who wanted and probably expected to stay at a company for a long time, and today, where, as you say, job hopping is, I mean, that's expected. You're not going to be there very long.
Yeah. Well, I reflect back on a conversation that I was in. It's been some years. It's been 6 or 7 years ago. Well, probably just about that long ago, but it's more rings more true to me today than ever. I happened to be in a small group meeting with Mitch McConnell, and he was talking to this group that I was in, and he brought up the fact of how quick things were changing. And he had an example when he was growing up, and I can relate to this where I grew up. The street that he lived on, kids were out playing. Remember, I was out riding bicycles and doing things other than being on the computer and in social media sites all day long. And he raised the example of all of these houses on the street, and at the end of the street was this big house, and it was the man that owned the hardware store in town and a couple of other businesses.
Mm-hmm.
And he had more than others. And everybody in that neighborhood looked up to that man at the end of the street. When he drove by to get his attention, to wave at him, their moms would tell them, if you work hard, study hard, you can be that man at the end of the street, because you can do anything you want to do and have anything that you want to have. And it feels as though everything has flipped to where, instead of admiration and wanting to be that person, there's this cloud of doubt, like, that person robbed and stole his way to the top. And anybody that I work for that's running a large company, I can't trust them. Any changes that they make in the company, it's something to get me. So there's this big level of distrust, I believe, that you have to overcome with the Gen Z and millennial generation before you can really start making some significant moves. And it's a big effort to gain that trust. And I don't know that you ever fully do.
Are there, Bobby? Is there an upside to that? In other words, do you observe that change in the culture? Do you see it as, there's an opportunity here for me and my company if I can figure that out?
Yeah, I do. It just changes the focus, right? Before there was this assumption we're providing somebody a job, we're doing them a favor, we're giving them an opportunity.
Mm-hmm.
And that, you can't skip over that narrative. It is part of, it's part of the recruiting, it's part of the onboarding, and it's part of the retention program. You're constantly having to prove and provide evidence of what we're doing and the good that we're doing as a company, or you stand the chance of losing that employee that you don't want to lose.
Right. No, that's a very good point. It's do you think that with the pandemic that we've all been through for the last couple of years, has that accelerated some of this change, do you think? I always think of this comment that Warren Buffett is at least alleged to say, that when the tide goes out, you can see who's swimming naked, right?
Yeah.
So Suddenly, boy, all this money gets infused into the economy. The supply of workers seemingly shrivels up pretty quickly, and companies that probably didn't have a real good relationship with their employees, they're struggling big time. Do you think that has the pandemic done that to some extent in your industry or in your business?
The business that I'm focused on right now is a service business.
Mm-hmm.
We're providing healthcare at home, and we've got all levels of healthcare providers and skill sets within our company. But the lower end of that has been the most effective. The stimulus monies, and even the fear, that comes from the pandemic and those type things have caused big challenges. I think, as you mentioned, some companies that didn't have a handle on their mission and vision and have that ingrained in their onboarding programs and just continually the way they do business definitely have struggled. I mean, everybody's had problems with staffing, I believe in the pandemic, everybody in the service industry, but it's definitely, we've fared better than most of our competitors, but it has been a challenge. And we've had to adapt to this changing times, right? We're not able to hire people as easily as we were before. It's been a limiter to our growth, but we're thankful for the staff that we do have. We wrap our arms around them. We make sure they know what we're doing as a group and the good that we're doing for the community.
Mm-hmm.
But saying all that, it's forced us to layer technology into the provision of the services. It's forced us to do more with less. The government has such an impact on our economy, and they always have, but I've never seen the impact be so great as it has been over the last 2 years. With the pandemic, just some of the ever-changing mandates, I'm taking some great operating people within my company. They used to spend 85, 90% of their time with my staff to ensure their success and the successful experience for patients, their families, and everybody else. And 75% of their time now is spent keeping up with government regulations and mandates. And it's so I'm afraid, that if we keep on this track, it's going to require us to be a lot sharper to maintain a level of service and the provision of that service that we've all experienced for years. It's just our industry and all.
And then when you spend more time kind of focusing on the letters of the regulation, it's less time spent engaging with those employees on what you're doing, the purpose, the mission, the day-to-day stuff that keeps them excited about things.
Yeah, absolutely. We're trying to, as a company, and I believe most service companies are, we're trying to anticipate needs and exceed expectations, but it's very hard to do that when you've got a lot of this other noise that happens. And when the people that are actually providing the service, our caregivers that are out in the field, when they hear constantly numbers every day, people trumpeting numbers of hospitalizations and deaths and everything else, it's very distracting. And, in the presence of that, and then simultaneous government stimulus and everything else, people pull back, and it's been tough. So it's part of the strategic plan now, I think, for any company that's really looking forward, is understanding how to deal with that as if it's not going away.
Do you have any sense, Bobby? They call it the Great Resignation. I think the number is like 24 million workers have kind of quit their jobs, gone out of the workforce. Do you have a sense of what they're doing, where they're going? Do you have any thoughts on
that? My focus has been more on how we deal with it, right? How we get more efficient, how we do more with less. But I believe a lot more people are turning to returning to the convenience of uh, the value of self-time versus time focused on providing and giving to a
Yeah.
company or community and in a way that we've been accustomed to for many years. So
Yeah. Do you when an employee says they're going to go somewhere else, and leaving your company, is there a pattern there? Do they say, I'm going to take some time off, I'm going to go over here, I'm going to switch industries? Do you have a sense of that at all?
well, in healthcare, we do see a trend of people saying they're going to leave healthcare.
Hmm.
Too much going on, too much noise, too much change. Um, but even with the increase in that response when someone leaves, more often than that, we hear, I'm just going to take some time for myself. And I think that's been a big part of that's been enablement
Yeah.
of different
They can.
programs
Yeah.
that allow them to be able to
Yeah.
do that.
Along those lines, Bobby, are there some changes in the culture that you notice that the pandemic's brought out? I'm not talking just about your company, your industry, but do you see some changes as you look around and that the pandemic sort of exposed?
You know, um, Alan, I don't know if this directly answers your question, but I see so many companies in so many industries that are struggling with the staffing and and the availability of
Hmm.
of people interaction to provide their product or their service or whatever, and they're all looking to be more efficient, whether they're turning to automation or turning to artificial intelligence,
Yeah.
and the it's changing the whole makeup of how a business operates. And I can give you an example. We turned to some artificial intelligence tools, and it's very easy to start looking at decision-based outcomes and things like that. And we were looking at some staffing type things, how productive somebody is, right? And how many productivity points, or how much
Yeah.
they're doing for their
Right.
salary, right?
Right.
Stuff that we all look at. And I'm getting these things spit out to me as this person's not being productive. We need to get rid of them, everything else, and replace them with somebody else because we just can't keep up with that level of productivity. And it just struck me so weird because this lady is one of I believe she's one of our best employees. And you dig in and you find out, and it took me a couple of days to understand what was going on and talking to several people within our company, but I find out that this person's handling some of our most complicated cases.
Hmm.
And so she's not as productive from a pure
Right.
standpoint of productivity, but she is providing a service that others aren't even able to provide.
Right.
And she's our go-to person for that. But so I worry that we're going to fall into these traps of
Yeah.
some poor decision making from this, but it's becoming sort of a necessity, at scale
Yeah.
to make decisions.
Yeah. You and I are in similar industries of healthcare, and I think that's one of the real struggles in our industry is that when you take something that's very complex and complicated to provide as a service, and you try to boil it down to metrics, and you follow those metrics, you lose some of the things that you're talking about. For this woman that you're talking about, a nurse perhaps. I mean, your company probably is worse without her. I mean, significantly worse because you're not taking care of those difficult patients. But if you look at the number of patients that she's seeing, probably not as many, right? Because there's more to it. And yet, if you look at the metrics, you would lose that value that she is providing.
There's certainly.
You mentioned something, about automation, AI, robotics, Bobby. I mean, this is certainly something I have thought about. I would guess you have too. In the healthcare industry, I would say we're sort of slow to adapt or adopt new technologies, robotics, and so forth, because there's a big risk to it, right? I mean, if you don't want to hurt somebody, you don't want to miss something, but in an era that we're going through right now, where I mean, it's a struggle to find nurses, technicians, et cetera, as you've just described. Is there a role? Is there something that technology starts to take over that people used to do in your field in healthcare that you didn't anticipate, say, before the pandemic and this great resignation that we were speaking of?
Yeah, I mean, we're changing business practices regularly because of this. I mean, we just, um, another example, we're having to stratify patients based on data points on which patients are at highest risk of rehospitalization. And that can be good, right? That can be very good. But when you start relying on that versus talking to a case manager that's talked to the RN, the registered nurse that's gone out to see this patient, the home health aide that may have gone out to take care of some things and just is observing things in the home. And you just lose these dimensions of things and it's pure data points. And while that can be very good and very helpful, you lose sight of maybe some more qualitative things that can be captured in a metric.
Yeah.
So we're seeing that right now, and so we're now trying to recapture a little bit of that common sense from a skilled case manager, and where to apply that case manager when we've got limited availability of that level of skill set compared to what was available just a few years ago. And it's a challenge, and I worry about that across not just our industry, but in all of our dealings with companies.
Do you have a sense, Bobby, of what your customers are expecting, or maybe a better way to say this, what they're willing to tolerate? In other words, perhaps particularly in healthcare, but people are used to sort of face-to-face interactions, right? Are your customers, do you think they're more tolerant of, hey, I don't expect to have face-to-face contact. I expect more online, less personal approaches?
I feel like they're getting more tolerant of it, but at the same time, um, we can't let that completely happen. We clearly in an environment where our payment structures are controlled by insurance companies, by CMS, Centers for Medicaid, Medicare Services. We're lucky to get 2% increases a year. Well, we're about to be facing much more substantial. We already are facing much more substantial cost of how we do business, just keeping up with regulations, mandates, and everything else. The people are expecting to be paid more. There's job hopping. You know what's going on with nurses that are traveling, and states are trading nurses and paying more. There's a lot of that going on, and we are not paid enough to stay in business to help our community and do the level of visits that we've done in the past. So it's all about patient engagement. We have to figure out new ways to engage the patients, not necessarily always doing a physical visit. So we've got to make sure, and what we're focused on is making sure we're there when they need us versus just a planned schedule. So it is making us more efficient, but we've got to continue to engage the patients. And I assume other industries, whether it's patients or customers or whatever it may be, that engagement is going to be very important.
Bobby, you raised an issue there that I'm just wondering. This question is a little bit maybe on a more macro level.
Sure.
But one of the things that I think the pandemic has exposed, and this was certainly going on before the pandemic as well, but it's that there is this growing inequality in the United States. So sort of an ownership class and a worker class, and the benefits of ownership and so forth starting to accrue to a smaller and smaller group of people, and then a working class that's really struggling more. When you talk just now about there's job hopping and certain jobs that are now getting 2 times, even 3 times the wages that they were before. Do you see, is that part, is that part of what's going on here? In other words, is this a readjustment, a narrowing, if you will, of that gap between the ownership and worker class in the United States? Do you feel like that, or do you feel like you're sensing that?
I feel like I feel like there is, like, it's definitely it's changing very fast, just like you described. I think that parlays into an environment where it's tougher to. Yeah, I think there's a distrust a
Mm-hmm.
lot of times between those classes, especially from the masses towards the few. And I think it hinders our ability to do some things that we want to do, you know, to advance the services we provide, the help that we provide the community, the help that we provide those workers.
Right.
Um, I think it goes in hand with the messaging that's so prevalent right now in, as I mentioned earlier, with this narrative that everybody is on in social media, that, these kids are saying, well, you deserve this, you can do this. And, they're just trying to get to you in this way or that. And, it's not healthy. We've gone from, uh, advertising jobs that are, you know, are pitching, um, an independence, like flexibility in your job schedules and these type things, but
Yeah.
salary. Um, and it's starting to not work. Meaning that, we're seeing people that, will come in at 9, they're supposed to be there, a 9 to 5 job. Maybe it's a 4-day week. And, we had somebody the other day that we found out was taking 2-hour lunches to do CrossFit. And we challenged her on how she shrunk an 8-hour day into about a 6-hour day or less, because of when she actually starts and when she leaves to pick her kids up. And we appreciate that, and we can work around it. But, she felt as though she deserved to be able to take care of herself and take that time, during a work day. And, and we want people to have that time, but, there's got to be a balance there. And so it's a challenge. It's forcing us to look at different compensation models to allow somebody to do that. If they want to show up and do a job and provide a mediocre level of work, great. And we can set a salary out there, but you got others that want to do more and make more. And so we have to set up, performance comp metrics to allow them to do that as well. So it's getting a lot more complicated, clearly.
Did you, Bobby, if you think back to maybe 3, 4, 5 years ago, did you foresee, or could you foresee any of this happening? I mean, these issues that we're talking about, and this cultural shift that we've been discussing. Did you have any inkling of that?
You know, I felt like I was more prepared, um, with going into the millennials coming into the
Mhm.
workforce. Um, but the Gen Z completely threw me for a loop. I was slow to react to it. Honestly, Alan, we missed some opportunities. Our hire slowed down a little bit because we just weren't effective. I couldn't believe, just personally, and maybe because I'm getting older and maybe a little bit more set in my ways, or trying to be, or thinking that I am. But, just seeing that we just had to completely change how we pitched ourselves and
Mhm.
um, how we interact with our staff and how we set up jobs,
Right.
in a way that can be mutually beneficial to the company and to that new values shift, or that value focus that's so important to these younger professionals that are coming in the workforce.
So, given that, Bobby, how does your changing think as you plan out, say, 2, 3, 4 years from now? Is it more of this, do you think, or how do you try and anticipate that in your strategic thinking?
There are core positions that that we're talking, we're assessing how effective we are, across the areas of retention, recruiting, and attracting these people. We're looking at it monthly at our stats and understanding what we can do better to create a better result, because it's changing so fast. I don't know that will ever change, but there's other positions that have been so hard to fill and so hard to retain because they are exiting the workforce, that we're turning to, we're looking at all other alternatives that we never would have considered as part of our regular strategic planning, outsourcing, of jobs, contracting to, a lot of jobs that, that we would really want to have in-house may be done, in some other state or wherever we can find the best person we can find, wherever they may be. It's not always a bad thing, but some roles you would rather have that in-house and, and interacting with your other team members day in and day out.
Maybe one final question,
Sure.
Bobby. So this has been a time of a lot of change, and as you said, the pace of change is so much faster now than say when you started your career.
Sure.
Are there some things that you feel hopeful about, that you think, this is really a reason to be excited over the next 2, 3, 4, 5 years, something like that? Do you have any of those kind of feelings?
Well, I've got the feelings. I don't have the solution yet, what it's going to be. But in my career, every time there have been changes, it's created opportunity that we've been able to, to realize in a significant way for the products that we created, the services we provided, the staff that we were able to bring on, and everything else. So I don't look at this as any different, other than it is happening so fast. And it is real time, that it is taking a very focused effort. The days of creating an annual strategic plan,
Yeah,
and living with that through the year is gone. I mean, we're real time. We're working our annual plan week to week and quarterly, adjusting and making changes to it. And I think that's going to be here for a little while. So
yeah.
we'll see.
It's funny you'd say that. I read one time that I'm sure this was back in the 70s or 80s, that AT&T had a 20-year strategic plan, and I think, oh my gosh, it's hard to have a 20-day strategic plan sometimes, and I mean that speaks to the pace of change that you're talking about.
Yeah, we can keep the goals out there, but the plan to reach those goals is a very fluid thing.
Yeah, the path to getting there is very far from clear. Yeah.
Definitely.
Well, thank you so much, Bobby. I really appreciate your time tonight, and thanks for doing this.
Happy to visit, Alan. Thank you.
All right, very good. Hey, I'll talk to you soon.
All right, bye.
Okay, talk to you about it. Bye-bye.